Hello, and thank you for joining us today. The title of this talk is Healthcare While Black: How Hemophilia Treatment Centers and Chapter Organizations Can Better Serve the African American Community. My name is Mosi Williams. I'm a social worker with UCSF, the Hemophilia Treatment Center, and we would like to start with introductions of our panel. First, Rigo Garcia, our HFSC Executive Director.
Yeah, hi there. My name is Rigo Garcia. I'm the Executive Director of the Hemophilia Foundation of Southern California. We serve 3,800 community members in 9 counties in Southern California, and our goal is to provide education, advocacy, and resources for all of our community. Thank you.
Chelsee.
Hi, everyone. I'm Chelsee Nabritt. I am a former NYLI member with NBDF. I am also pretty active with HFA and with HOG. And I serve on the board, on the planning committee for NBDF and on the board for Hemophilia Alliance Foundation.
Thank you. Brandon.
Hey, everyone. Brandon Young with Country Boy Fishing. Basically serve nationwide fishing programs and other alternative programs for the community to get us more active and get us out there and make bonds that stick. Currently on the board with the Tennessee chapter board, so I'm actually on the board with them, and just out here, spreading the love and showing the love of fishing.
Thank you. The reason that we would like to have this talk today, the Center for Disease Control declared racism as a public health threat. And African Americans in this country have experienced significant health disparities due to race. The title, Healthcare While Black, there are other hashtags or phrases, so to speak: driving while Black, working while Black, where Black people have experienced racialized experiences. And so today, with our different roles in the hemophilia and bleeding disorders community, we would like to talk about ways that we can decrease or minimize the gaps in an effort to eliminate gaps of healthcare disparity. And so to open this discussion, the first question would like to ask Chelsee, as a Black woman, what has been your general experience of the healthcare system? Do any particular situations, memories come to mind? That's a lot to ask you at once, but yeah.
It's okay. It's totally fine. So my experience has been a little different. I was diagnosed with platelet storage pool disorder at the age of 7 years old. And obviously at that time, it was a very new rare disease or disorder. My family knew nothing of it. They would call me a free bleeder. And I would have really, really, really bad nosebleeds. I'd come home from school with blood all over my shirt every day. And I just so happened to be at a friend's house, and her mom worked at Children's Healthcare of Atlanta, and she told my mom to take me over there to see what type of disorder I may have. Upon that, going to camp, and then growing up and in this bleeding disorder community, there weren't many people that looked like me. Obviously now there are, which I'm very thankful for, but that with it being so much more people that look like me, that raised awareness to, well, we need doctors that look like me, we need OBGYNs that look like me, and it started to just kind of make me raise my eyebrows once I got older. Once I transitioned from the children's aspect of things and over to my adult HTC, that's when I started figuring out, okay, I need to make sure my doctor is paying more attention. I need to make sure that my OBGYN is paying more attention. At the time, I did have an Indian doctor, and my OB was a white lady. And then I swapped over to an African-American lady, and thankfully my HTC kind of heard my concerns, and they brought her in. And so now they have the OBGYN, they have the social work, they have all these different people that I need to speak to for my yearly appointment. And everyone is there. And so now when I go to my HTC to talk to them about whatever it is I need to talk to them about every year, there's someone there. There's a doctor that looks like me. There's one that does not. And there's other people in the community that are able to help me. It was not always gravy. I can say that. I think that the African-American doctor that they have on staff now is great. She's phenomenal. However, she wasn't the best fit for me. And so once I started figuring that out, I said, okay, I have a bleeding disorder. I am also an African-American woman. I need to find another African-American woman that can help me with other concerns I have while trying to navigate, okay, once it's time for me to start having a family, what does that look like? How do I prepare for that with a bleeding disorder? And just trying to make sure that I was on track with everything that I just wanted to make sure I was healthy, if that makes sense. And I ended up talking to my mom about it, and she shared her OB's information with me, which is a older African-American lady, and she was able to just really give me the head to toe diagram, like just make sure everything was T's are crossed and I's are dotted. So I've been going to her for a couple of years. She understands my bleeding disorder, and so I finally feel heard. And so that's been a little bit of my experience with that. Long answer for your two-part
thank
question.
you. No, for a huge question. And, you really highlighted a number of things, particularly about, wanting someone to understand, and someone that looked like you, and then the fact that they may not necessarily always understand. And so I could hear, as you talked about, meeting with them, requesting it, and then meeting with them to see if it was a fit, and then finding someone, who could support you and help you to meet your needs. So yeah, thank you.
Absolutely. Thank you.
Yeah, Brandon, what's been your experience in from diagnosis to where you are today?
Well, my experience has been not bad. I come from a long line of hemophiliacs, so my family has been very, like I say, groomed, but we've all went through these trials and tribulations with my grandfather and my cousins and my brother. So there's a big line of hemophiliacs in my family. So we've all helped each other with the information and pass it down, who's good to represent us and who's good nurses to be a part of, doctors and so on and so forth. But I've heard of stories dealing with my family of, difficult times dealing with hemophiliac, being hemophiliac. And, sometimes there's some people get lost in the mix dealing with, my mother and my grandmother and, women in our family not being diagnosed at all and still trying to go through that whole tradition of, women are not hemophiliacs. Now, well, to the day and age, we're coming to find out that there are women that have these bleeding disabilities also. But in my time, I'm 44 years old, I've experienced some beautiful people. They've helped in numerous ways, from Texas all the way to Georgia, and walked us through these, through these fine, difficult times of trying to understand this diagnosis and, going through the healthcare system. Now, that's a totally different conversation, talking about the healthcare system. But just being, an African-American Black guy in, with hemophiliac, I've been blessed. I've been very blessed.
Thank you. I appreciate you saying that. And you mentioned, a family history, of hemophilia, and then and the women in your family, not being acknowledged as having a bleeding disorder. And, to this point today, we know that, a lot of women have mild hemophilia. It's not just carriers that don't have condition, that don't have symptoms, right? And I can say from my own experience as having severe hemophilia, I was the first one in my family. My mom was a carrier of hemophilia, possibly mild hemophilia. She hasn't been tested. I said, Mom, you got to get tested, which, goes to later what we're talking about. Why aren't we, always accessing the system? But, finding that out. And then I've had a number of experiences such that trying to access the system, and not necessarily hemophilia, but getting to the hospital, being profiled and a number of things. And so dealing with that as a Black man, I can see why some people, if I have to deal with this just to get to the hospital, I'm not going to go. I'll figure something else out. I'll just use ice, and I'll just, I'll figure this out some other way rather than go there and deal with that. And so, my next question is, following with that for you guys, and start with Chelsee, have you had to deal with these? And Brandon, you kind of alluded to some of that. Like you said, you mentioned accessing the healthcare system. That's a whole nother discussion, right? And maybe we can talk about part of that. But have you had, racialized experiences within your healthcare? And what do those look like? Or family, have you dealt with that?
Yeah, so for me, as I stated before, it was very rare once I was diagnosed. It was not that many African American kids at camp. Now you go to camp, you do see much more, but there wasn't a strong presence there. And because of that, my mom did say, she was like, no, you will stay active in the community. This is something that we've got to learn about. You have to tell your friends, you have to tell your teachers, like, we have to spread awareness because this is something so rare. People need to know what to do if you were to break out into a nosebleed, or if something were to happen and you get hurt, you're going to bleed. So everyone needs to know what's going on. Therefore, on the back end, she made sure insurance, doctor's appointments, everything was very well taken care of. It even went all the way down to dentist appointments. I had to make sure I informed the dentist. I had very many teeth extractions because my teeth, for whatever reason, decided to develop extremely slowly. In order for me to get braces and in order for me to get anything done regarding dental work, I had to make sure the orthodontist and the dentist knew exactly what was going on. I had to warn everyone that I will bleed very easily. I have taken my medication. However, just try to be on the more gentle side because I may bleed. It's just that extra step that you have to go through to make sure that everyone's on the same page. And there were dentists that were like, oh, well, we don't want you to come because I don't want to be held liable if you were to bleed too much, or I don't want to be held liable if your medication does not work and I have done a tooth extraction on you and you go home and you bleed out and you die. So, I mean, I have been told no many times. And we ended up finding two, and I still go to these dentists now. We found two really good, a pediatric dentist and an adult dentist. And then my orthodontist, they were all best friends and they were in the same plaza together. And they were the sweetest guys ever, but they took the time out to kind of really understand where I was coming from. They heard my cry out to, like, hey, I'm deathly afraid of needles. I do not necessarily want to be hurt. I don't want to be in pain. However, I know that there are things that you all have to do because it's part of your job, and overall it will help me in the longer run. And they also heard my mom as a concerned parent, like, hey, this is my only child. She has a bleeding disorder. What is it that we have to do? So it's just trying to be able to figure out the balance of communication, try to get everyone on the same page and be able to accept that denial and just say, okay, you say no, but let me go find someone that will say yes and is willing to do the work and work with me.
Thank you. Yes, that's an excellent points. And you really reiterated that, what you had to deal with being one of the few. And so sometimes it's not necessarily, a blatant discrimination we experience, but you're just being isolated and feeling alone and not seeing others in the same situation or going through it and not knowing, feeling strange or awkward for being the only one. And I hear you as being a fierce advocate for yourself, like, dealing with the denial for whatever reason that it happened and having to fight through and continually challenge the system and ask for what you want, what should be given, as part of healthcare regularly. But now you've got to advocate more as a result of who you are.
There were many times where I was like, oh, maybe let's just not do this anymore. And I would want to give up. And my mom's like, no, we're not doing that. We will be going to this doctor. I found this dentist. I found this person. You need to go. You're going to not go to school this day because you have all of these different appointments. And we'd spend a full day going to different doctors' offices or going to different dental providers. And right now, our HTC, obviously now there's a number of resources that we can go through. to try and get like to make this process easier. But back then we didn't have that. So you kind of had to figure it out a little bit on your own. So it just looks different for everyone in the community.
Right. And resilience is a key for our community, right? Not giving up and continuing to fight. Thank you.
Absolutely.
Brandon, for you, have you felt isolation or, you know, racialized experiences accessing the system? What has been your experience?
So I'm gonna look at that on a different scale, because I've never had that issue. The community within our community is very, very interesting. So coming from Texas, you know, it was more of a family situation, dealing with one of the Texas Children's Hospital there. They really got behind my grandmother who raised me and my brother, and they really with, you know, at least organizing certain doctors who were better suited for our care, and I guess within their system. They also helped us with, you know, dentists and eye doctors and stuff like that, that was a little bit more familiar with the way, you know, our hemophilia world operates or whatever. I will always remember Dr. Buchanan. Only a certain amount of people really know about that guy, and he really was an advocate for hemophiliacs in that day, and he was one of my doctors. So dealing with him, I think the hospital that he was working out of really had a hands-on pulse on the community on, you know, the best way to suit our medical needs and whatnot. So with that hospital, that really helped us out. Being from a small country town, now dealing with the healthcare system is a totally different, like I said, a totally different conversation. But having him as an advocate helped us really navigate those waters because, like I said, coming from a little small country town, Shaw Falls, Texas, it was really difficult because they've done some operations on me personally that's frowned upon us as a community, where, you know, I have plenty of stories, if that's what you want to go into, about how, you know, being treated in those certain demographics. So we had better relationships and whatever when we moved to Dallas versus being in a small town and having to deal with hemophilia in that aspect also. Because you got to understand that hemophilia is, we all know each other, but our community is really, 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 really small compared to the massive diagnosis of everybody else or other eating disorders out there. So we're very, very small. And so not a lot of people know how to treat us. I've had the same, you know, situations where, you know, I don't say dentists turn us away, but doctors be scared to touch us. They'd be scared to give us any type of assistance or even try for treatment due to the fact that A, our medication is very expensive. Two, you know, we consist of a lot of care. And three, that, you know, accessibility and resources are very limited to our community in general. So therefore, we have a very niche type of situation where we all need to work together, support each other. And that's probably what we'll talk about majority in this call, is basically supporting each other and working together. So, you know, our community is a community, and we all work together in certain aspects, but we can do more for each other. And that's basically, you know, dealing with the healthcare system in general, but just also being a part of the community as well.
Thank you. Yeah, please share a story. You said you had several, so share. Yeah, we have some time, so go ahead and share a story about, you mentioned the transition from a small town to Dallas. So.
Oh, well, I got diagnosed with hemophilia. It was one day I was, as a 3 or 4-year-old, bouncing on the bed of my aunt's bed, and I hit my head in the center of my head on one of the posts or whatever. And so it obviously a knot came. One day I'll share that picture with you guys. The knot came, and we went to the emergency room, and the doctor said, "Oh, we want to lacerate it so we can bleed out." As you already guys would know, and everybody's eyes would know, they did that. They lacerated it bled out, and it was like, he won't stop. We won't stop bleeding. We're going to stitch it back up, but he won't stop bleeding. So that's where I was introduced with this thing called chicken noodle soup to me as a child, but it's called Creole lactate or something like that. The plasma, the plasma bag or whatnot.
Okay.
I was exposed to that at an early age also. So, you know, being part of a small town, they quick to try to cut something off. and that didn't work out well for me at that time. But got stitches on top of my forehead. I do still have a little mark right there,
Really?
but it is, that's how I got diagnosed with hemophilia because of, being cut in the middle of my forehead, lacerated. My last past experience, was just my worst experience was probably this past couple of weeks ago. Actually, I had an elbow bleed, and I was back in Wichita Falls, and the fact that, let's just say they put me off to the side, and all I was going for was make sure that I didn't have an internal bleeding inside my elbow that was going to be drastic. I did take my medication, but I was trying to go get some pain management opportunities for that, but it didn't work out well. So I was sitting at the hospital for roughly about 8 hours, and to the point where, you don't want to come off. Us hemophiliacs, we know exactly what's going on with our bodies, but we don't want to come off too dominant where we won't get treatment also. And that's where I was trying to allow them to, let me help you understand what's going on with me. But you don't want to be too forceful where you might not get treatment at all. So, you run into those individuals that, that know a lot, but don't know a lot. So I ran into a couple of those doctors, and they wanted to tap my elbow, wanted to drain it. So we're not going to do that, but can we find out some type of pain management opportunity for me? But long story short, I was at the hospital for 8 hours just to get some pain management. That was it. And they put you in the back. They put you way in the back. And let's just say I didn't talk to the doctor until 3 hours into the visit. And I'm in excruciating pain. It was unbearable. Guys, you know how it is when your joints swell up. So, it was one of those moments where I could say those were a couple of weeks ago was like one of the top 2 experiences that I would never forget in a hospital. But I don't know. I do know. I'm gonna be honest with you. I do know. I had one nurse, and at that time there was a lot of people coming in at that time, and I had one nurse said out loud. She said, "What do we look like, a drug store or something like that?" This one of them. Oh my gosh, it was ridiculous. So, so
they finally said it.
To,
finally got it said.
Yeah, they said it, and it hurt them, and it kind of hurt me real bad. But you still got to keep a smile on your face, and as much pain as you are in, you still got to be pleasant to talk to, because guess what? These people are serving you, so you have to, make it easier for them. But there are, certain, how can I say, certain stigmas that come along with this that are misrepresented, and you just have to deal with it. Being, just being who we are, in the community, you just have to sometimes roll with the punches. So those are my 2 experiences thus far. I got plenty, many more, and it's a sad thing. I would love for our younger youth to talk to more of our older or seasoned people in our community, because those are where the real stories lie. I was around a couple of seasoned people a couple of years back, and I heard some of the stories, and the stories are traumatic, but you will learn how far our community has come from there all the way to where we're at right now, which is a beautiful thing. We have more representation, more programming, more opportunities, and more opportunities in our community. But to talk about where we came from and where we are now is a beautiful thing. That's why we're here now today talking about this. Pushing the pendulum forward. So yes, we have, we're making a way. Keep hope alive.
I want to piggyback off of that.
Go ahead.
Because I had a similar experience to that, but I think the reason mine changed is because I look much younger than what I am. So I got into a really bad car accident in Florida. And I did not have my medicine with me. At the time I was taking Amicar and Stimate, and I did not have my medicine with me. I had, it was a car in front of us. I was in the middle car, and then there was a truck that rammed into the back of us and pushed us into the first car. So I was like hamburgered. And I had my seatbelt on and everything, but because it happened so fast and we were sitting at a light, it didn't pull me back and just hold me back. My face went forward and hit the seat in front of me, and I broke my nose. So obviously my nose started bleeding. Couldn't get it to stop. I'm in Florida. I live in Georgia. And I was like, oh, this is going to be an experience. So I told them as soon as the ambulance came, I told them, I said, hey, I have a bleeding disorder. I always wear my medic alert on me. I showed them my medic alert. And I was like, I gotta go to the hospital like right now. And so they took me. My teeth were busted, like my lips was busted. It was just, I was really bloody in the facial area. I called my mom on the way to the hospital and I was like, hey, got into a car accident. I don't have my medicine. I need you to come down here like now. And so she was like, okay, I'm coming down. But obviously if I'm in Florida, she's in Georgia. It took her about 6 hours to get to me. Thankfully I was rushed to the emergency room. But my experience there was much similar to yours, Brandon. I got back there and I kept telling them, I'm in pain, my face hurts, I'm bleeding, I can't stop. I told them I need Amicar Stymate. I kept saying it. They wanted to give me aspirin for the pain. I said, nope, I can't take aspirin. I have a bleeding disorder. That's a huge no for me. And then after a while, like of negotiating, quote unquote, with the nurse, yeah, she got to the doctor because I was like, I really need to talk to a doctor. I think I need to speak to a doctor. And she got the doctor in and he said, well, the nurse has been telling me your concerns. I'm going to give you some pain medicine so that, because I mean, your adrenaline is really up. Let me give you some pain medicine to kind of just level you out. And then I will try and figure out if I can get the Amicar or the Stymate. I said, okay. Again, I'm not a fan of needles. They give me an IV, they give me some pain medicine. I can't even tell you what the pain medicine is. I don't know. But I do not react well to pain medicine. And I started like hallucinating. So now I'm in a hospital, I'm hallucinating, and I kind of got the bleeding to stop, but not really. And so once I finally did, after like it took about 2 hours for me to get it to kind of slow down and just stop. I had to go to the restroom and I was terrified because I'm hallucinating that these little children are running around like talking to me. And so I told the nurse, I said, hey, look, this may sound really strange, but I really need you to take me to the bathroom. Like, can you come in and just walk me to the restroom? And you don't have to go in with me, but if you could just stand outside, because I'm just really scared. I'm in a really strange area. I don't have this medication. I barely got the bleeding to stop. My face is swollen. Like, it's just a lot going on. She said, yeah. And, the second I went in and closed the door, she leaves and goes, she's clearly she's never been on drugs, or clearly she's never done X, Y, and Z. And I'm like, what are you talking about? And so I come out, she's gone. I don't know how to get to the room because I'm like, I don't even remember where we went. And so I went to go ask another nurse. She told me where we were. I asked, where were my friends in the car accident? Can I go in there with them? Because I would rather not be alone. I don't know you all, and you're trying to kind of put different medications on me that I've not heard of. They said, no, you can't. It's a violation. You need to stay in the room. I'm like, okay, fine. I'm not knowing any of the rules. So I'm like, okay. And then the doctor came back and he says, well, we don't have Amicar Stymate. And by the way, those are two very expensive medications, but we do have like a related like type of medicine. It's not the same, but it's kind of similar. So we can try it out on you. And I said, try? I'm not a guinea pig.
Try.
Let's not try anything. So and again, I'm on pain medicine, so I'm really, really loopy. And so I'm kind of going back and forth with the doctor, and I was like, I don't think that's a good idea. Let me call my mom. Like, I haven't heard of any of this. Let me see if she has. And as soon as I called her, thankfully, she walked through the door. She was like, "Hey, where are you? I'm walking in now. What room are you in? I have the Amicar, I have the Stymate." And then they tell us, "You can't bring any
Yeah.
medication from the
Brown
outside
bag.
inside the
Right.
hospital." So it was just, it became a huge thing. And I'm like, okay, well, let me get discharged now, because now I feel comfortable. I'm ready to go. I have my medication. I'm ready. I want to get out of here. And so I can see where it can become like just so chaotic and so like just throwing you from person to person like you're a little guinea pig or something, and then just not feeling heard when you're at your most vulnerable point.
Mm.
It can get to be very frustrating. And like I said, I look very young, so people will literally assume, "Oh, this is a 18-year-old child, she doesn't know what she's asking for, let's just do this, that, and the third." And they think that they can do anything without like really getting, or without really giving me full details of what's going on. So to make me say yes to something to kind of silence me, and then they're on to their next thing. So it can
Right.
become a little frustrating. But I try my hardest, like you said, Brandon, for kind of like more seasoned people or people that have experienced something similar to this, I try my hardest to go back and speak to the youth and just let them know, "Hey, you have to advocate for yourself. Yes, the doctors do know a lot of things, but nobody knows your body better than you. And so you have to advocate for yourself, because if you don't, sometimes people can take advantage of you and just try and get you to do all of these different things that you may not even need to do."
Wow. Thank you, Chelsee, for sharing that story. It's just sad. And I mean, and Brandon as well, like both of you guys, the emotional experiences you went through. And, thank you for telling those to us here today. And like Chelsee, what you experienced being dismissed, like you said, you look younger, that, not having that voice, the voice being taken from you. Medication is so expensive, but then, you can't reuse your own because, the whole brown bag thing and all of that. And, Brandon, what you went through, treated like a drug addict, but Chelsee, they've determined that you're not because of how you respond, so we have these assumptions about us as people, and
Yes.
the way you both have powered through that, and these are the reasons why we don't want to access it. Generally, our people don't want to access the system because who wants to deal with this? Well, you know what? I might try a home remedy or what something my grandmother told me. It may not work, but at least I'm afraid of going there for something that might happen, receiving something, aspirin, that's going to hurt us, right? And so there's the experience emotionally and physically of the health system sometimes harming us, when the Hippocratic oath is to do no harm, but yet we're harmed in going through this. Right. And Chelsee, again, you mentioned advocating, your mom advocating, you advocating for yourself. And Brandon, same thing. And you also mentioned having an advocate, I think you said Dr. Buchanan, having an advocate that understood and that got it to help you. And so, in addition to, trying for ourselves, we have our families, but we also need advocates in the system. And so when we think about what we're missing, I mean, I'm also a patient with bleeding disorder, but I'm part of the system. So am I, as a healthcare worker, what am I missing? What are we not doing to make it comfortable and to treat Black people equitably? And also, as Rigo, as an advocate for us, as an executive director of a hemophilia chapter, a bleeding disorders chapter, what more can we do? When you're hearing this and you've been working in the community, so your experience and what can we do?
No, thank you so much. And this is what we hear all the time, and I've been in healthcare for 20 years, and we've heard this not only in the bleeding disorders community, but in many African American communities, where like you said, Brandon and Chelsee's experiences are too often so common. You have to keep your voice down because then you're going to be the angry Black person. We've heard that so much. And no, we're not going to give you medication because you know what? African Americans have a higher tolerance for pain. No, it's not that. It's one of these things, and we hear all of these, remarks that we want to say a lot for us being a person of color. These are microaggressions, and these are you want to say it's blind racism because they're not trying to be racist, but the things that we're hearing, because these are so many times what's the labels that are given to us, and especially so many more labels that are given to the African American community. Being the executive director at a chapter that is very diverse. We have we have a lot of Latinos, we have a lot of African Americans. We do a lot of events, and I had an African American family come up to me at one of my events and told me, she's like, Rigo, it'd be these what you're doing is great, but there aren't families that look like me. Look around. I think there's one or two of us, and we feel out of place. And it was so very true. And for me, I felt that we were doing so much for the community, but when I looked around, yes, we were doing a lot. We do a lot of Spanish presentations, and that's great for our Latino community, and that's why we see a lot of Latinos in our area. But we don't do African American community, and all of us all the time when we do programming, we're saying we're doing programming for everyone, and that is so very true. But there are specific programs that we need to focus on that are specific to specific groups, and not that we want to silo. That's not what we're doing, but the message comes across very differently, and how we get that message comes across very differently, and we know that, and a really great example that I'm just thinking like that is our religion. Look at our different churches. We're all getting, the word,
Yes,
but we get
right.
it in very different ways, and that's how we should be as well. And how can we continue to encompass that, when we're talking about the care or the programming that we're doing with the chapters across the nation or the treatment centers across the nation. By no means us creating this platform is it putting anyone down. It's just the miscommunication that happens. And with that miscommunication, there is a lot of missed opportunities for better care. And I think the goal for the treatment centers and the goal for a lot of the chapters, not that I'm the voice for both, but representing my chapter, I could say, we want to be able to provide quality care for all of our community. And that's why it's really important that we hear the stories of Brandon and Chelsea and really be able to learn from that. So when Mosey, you ask, what can we do, since you're at a treatment center again, is we need to really hear the voice, and not that the African American community does not have the voice. I do not want to say that. We need to be able to provide a platform where we can hear them, we can listen and hear, and not judge and become so reactive. So many times, you bring it to, if Chelsea would have brought it up to that nurse, well, I heard you say this, and it's like, oh no, well, I was just trying to help you out or whatever. There's always, a reaction, and that's not good. Even with the medication that we hear, we hear that so many times across, it's same but different, and that's a lot of times what we feel when we're receiving healthcare. It's same but different, because it is different care that we're getting. It is different care that we're being provided, being put in the corner of the ER room, or not being seen, or you're coming in for X, Y, and Z, which is not the case. And I think one of the biggest things that treatment centers and chapters need to do is sit back, listen, and not be reactive, but really be able to learn from that. And I think that's one of the things that myself as an executive director have been trying to do. When that family brought that up to me, I'm like, okay, what can we do? And how can we really, get more bang from our buck when we're working with our African community, African American community, to bring them in. We have a lot of movement with Juneteenth. Can we do more events around that time? Before, everything we did was in the month of February, and I have to say the shortest month, of the year. And I'm going to be true and honest, but it's like, it starts on the 1st and it ends on the 28th. And it's like, no, healthcare is throughout the year. These that we live through are throughout the year. And so it's great that we're able to do a celebration like Juneteenth. Now, what can we do to be able to kind of be on the coattails of that, if that makes sense? In Southern California, we've been doing a lot of events, and I've been able to provide a lot of healthcare during those events. We do blood pressure testings. We've been doing so many things during these Juneteenth park events, when it wasn't really a national thing, but now that it is, how can we continue to gain momentum from stuff like that? And I think having a panel like this, where we're hearing the voice of our community, is a great start.
Thank you, Rico. I appreciate you speaking to that, and also being part of this and helping organize this. The platform is the key. Like you said, there's a voice, but giving a platform for the voice. And you said it's not about siloing, but different cultures have different cultural needs, and there are different ways to respond to these needs that may not be a uniform way that will one particular meeting or session that will address what everybody needs, right? Or the way that they would respond. And so in thinking about that, you mentioned asking families, what can we do? In looking at the history, of this country, why, with the way that the United States misused Tuskegee University and during syphilis research and things like that, there are reasons why Black people may not want to be a part of different health systems and activities and things. So, like you said, reaching out, like you mentioned during Juneteenth, and health continuing throughout the year. Like, so outside of that, what else can we do? And this is an open question to you both, Brandon, Chelsee. What other things can we do to engage and try to increase participation? And Brandon, country boy, you got your fishing program, and if you want to discuss that, and that's exactly what we're talking about. And that could touch us and others too that fish, right? So like things like that. Please share, and then what else can we do to engage our community?
By engaging the community, you gotta have niche program. The program has to actually have some type of service and some type of relating point for the community, because we all know, well, let me throw it out there. There's communities within our community. And that's very, there's different type of communities within our community. I'm gonna stick on that also. So therefore, we gotta find and have a good representation out there. And that's another thing that we need. We need representation, somebody to speak for the community, but also engage with the community in a certain way where, they feel welcomed. And that's another thing. They need to feel welcomed. They need to have something that the resources that will cater directly for them, because at the end of the day, it's all about what is it in for me. And you want to try to get those people to get involved with that in some way, shape, or form. Because like you said, there are stigmas. There forever will be stigmas. But we have to get our community, let's say the Black community, to actually be more engaging. We need to support each other. Point blank, period. I'll say that to the end of time. We need to support, we need to support. And more support, then we get more relevance in the situation also. So, having catered programs, and not to say catered programs, just say programs that are themed and hit directly to our community in itself will help bring more of us out. Having good representation. You created the fishing program, but fishing doesn't matter on who it is. It's more of a generational thing with fishing. So, you use this fishing as a source of food. Teach one man how to fish, he eats for a day. You teach a man how to fish, he eats for a lifetime. You know what I'm saying? So it's a whole model that goes along with that. But when you cater to our culture, it has to be theme-based, it has to be eye-catching, and it has to give them a sense of support. With all that being said, then we get more bang for your buck as a chapter when you have that type of representation and you have that type of spokesman there for you to help you introduce the chapter once again to the community, because it's all about feeling safe. One thing about tell me if I touch bases, and I know a lot of my bleeding brothers and sisters will understand. In our community, having a bleeding disorder is something that we try to keep tucked. We don't try to show it out. That's something that I know as a young adult, I don't want to be different. I don't want to be I don't want to be the odd guy out of the group.
Mhm.
So therefore that falls in line with a lot dealing with our community, is that we don't want nobody to know that we're going through pain and we're suffering. And sometimes that's a detriment to ourselves. And sometimes as a mother, father, whatever, we have children that deal with that, and we don't want to be stigmatized also with that. So guess what? Hey, we're calling a sick day where you don't have to go to school, and we hopefully, put some ice on it and it'll heal up, and then we keep it moving. So those are the things that we have to we got to get over, you know what I'm saying, as a community in itself, or as a culture in itself, trying to bring out to the community. So for a chapter, just support and resources. That's the only way that you're going to be able to bring people out, is support and resources. When you actually have that support and those resources that actually hit the nail on the head, you're gonna get more participation. And getting more participation, then you're going to get more people to come out to the events, and then they'll get more education, and they might have more of an understanding of how to better treat themselves. I believe this is just a wild guess to myself, there's probably, if not more, 15% hemophiliacs that are untreated in the United States. Probably more than that, is because they don't want to show that we have a disability, and we get stigmatized with disabilities. It's just like mental health. We have a stigma about mental health. So therefore, it's the same thing. It's basically, you don't want to be the oddball out of the group. And so what we got to do is make it more acceptable for everybody to, to bring it in, or to actually be a part of it. It's nothing. You're let me show you what I can do so you can do it better. I love a little slogan or whatever, but it's just basically being more inclusive and bringing people out and having resources, and making it feel homely and being welcomed, and representation is everything.
Great points. And I'll hit on this, and then Chelsee, if you would like to add too. You hit a lot of things. Then, you mentioned, catered program or things, support and resources. And so, in thinking about things that we're comfortable with, you said making it feel like home or homely. And you also like the idea of the multiple identities, the intersectionality we have. So you mentioned being a Black man and with a disability. So I'm already I'm already isolated as a Black man. Then having a disability, and being a stigma of that, and then also stigma being a Black man. Chelsee and you being a Black woman as well. So triple minority. And so when we consider that, and not wanting to bring attention to myself, and I'm gonna, what, I have this bleed, I'm gonna stay home. And I did the same thing. I kept taking, missing school. My mom said, you didn't miss so many days, you got to go, because you're gonna fail if you miss any more days. You got to go, and you got, people are gonna have to know, that you're having some things with you, and so feeling, but in our community, we can feel comfortable in the events, with our disability, because others have this, so having things be comfortable when we're there. And I think that starts, like you mentioned, your fishing program. And so if people come to those and feel comfortable, then maybe we can have a conversation about talking about clinical trials and those things. Maybe you want to look at these new treatments that are coming out, and have a discussion about them. Maybe you don't want to talk about it at the HTC, but maybe we can talk about it here, or in a programming like this. And so maybe people be more open if they feel comfortable. And it's starting with, with the support and resources. Okay, this is what I need. This need is met. Now I feel comfortable. I can ask you about something else, or I'm open to hearing, what you have to say. Chelsee, did you, what do you think? What are your thoughts?
Yeah, I did want to add to that. I just want to say, I think that sometimes people can overthink how to approach the Black community, which is very interesting to me, because you don't overthink how you're going to come up with a regular event. You don't overthink how you're going to come up with the LGBTQ event. You don't overthink how you're going to come up with all these other different events that you may have, or that you may plan for your organization or chapter, or whatever the case may be. I also think that it's interesting because, like I said, when you come up with an event, a baby shower, a birthday party, whatever it is, you don't have to think about, okay, well, I hope I don't offend this person. I hope I don't do this. You don't tiptoe around the event. So I think that if, like you said, for Brandon, like Brandon mentioned, if you have an event where you're sharing resources and you're talking about the different things that need to be raised up for awareness, if you try your hardest not to think about what is going to offend someone and you just look at it from the angle of, well, what if this was me? It would be much easier to try and plan that event. Another thing that I would like to say is the Black community is the most, and the Latina community, honestly, this community, we're very adaptable because we are so used to being stigmatized, dealing with discrimination, like because we are so used to just having to deal with that survival mode. We're pretty easy to deal with when it comes to, hey, we want to do something for you. 9 times out of the 10, your response is going to be, okay, great. What do you want to do? If you even ask a family or ask someone, hey, well, we're thinking about holding an event and putting X, Y, and Z in there. What are your thoughts about that? What do you think we should do? Do you think we should take this out? Do you think we should add this in? Communication is key. And then also what Brandon mentioned, like, that stigma, the stigma isn't just out in the regular world, it's also within our community. We have got to support each other more. We have got to speak up about things that are typically held in the household and don't come out of the household. It's other things that just need to be blatantly said. Just like with the bleeding disorder community, there's a mental health side to it. That aspect ties into your bleeding disorder because that has an effect on your mental health. I think that a lot of people are failing to realize that. And then once COVID hit, they were like, oh, everyone needs to now talk about mental health. And I'm like, well, it's kind of been a thing. But now that we have awareness to it, great, welcome. And so I mean, it's making sure that the community and not just the African American community or not just the Latina community, everyone is making sure everyone in the community understands we have 988 that's available. That's a confidential crisis line. You can call 988 24/7. You can text 988 if you have a situation happening with you where you are in a crisis or you are feeling suicidal or you are feeling like, look, I don't want to talk to my family about this. I don't want to talk to my friends. I feel isolated right now, but I do need to talk to someone. You have 988 to utilize. That's a resource. I think it's just, it's getting out of our own heads and stepping into the shoes of someone else. It's learning to see things from a different perspective. It's trying to make sure that not only are we spreading awareness about different services, but we're also spreading awareness about showing support. We're actually having someone's back. We're actually not getting offended when you hear the voices or the reactions back from someone. It's everyone coming to the table with a positive attitude, because once you get that, that's when everything is going to shine and fall into place. And then that's when you're going to be able to grow. I think that when people come in from a different angle and they are not willing to be open and honest and able to hear from a different perspective, that's when you have the friction. That's when you have, oh, well, now you're being offensive. Oh, well, now there's a different excuse. So I think that it's just about balance. I also think that there are people out in the community who are biracial. There are people who are multiracial. There are people who just have all of these different races within them, and they feel like they don't belong to any community. So, I mean, it's to the point where you make sure that you have something that's highlighting the African American community or the Latina community, but you're not closing it off to making it to where other people do not feel welcomed at all. It's still open for everyone to be able to join in, but maybe this focus is just on the Latinas. Maybe this focus is only on African Americans today, but that doesn't mean that you are not included. I think that people get the perception that because it says that this is an African American event or a Black information session, that means that they are not able to attend. That's not what that means. That means that it is a focus. This is the main focus, but anyone can come. If there isn't a Latina event or a Latino event, or even a Hispanic event, like, I mean, it just, you know how it is, Rito. Like, it's just differences. Like, people try and clump everyone. Oh, they're all Hispanic. Just put them all together. Like, it's raising the awareness on the focus, and then making sure everyone in the community understands this isn't about seclusion. It's not about division. It's about raising awareness on this specific topic and then growing from there.
Right, right. Great points. I think, and you know, you mentioned the overthinking, and I think, you know, and not happening necessarily with other groups. The African American experience, I guess, being brought here and then being enslaved on this soil is a different one. And I think because of that, the guilt of the country and not knowing how to, you know, to work around that, how to speak to that and acknowledge it, you know. And so the solution or some things to help with that, right, is cultural humility, asking questions like what would be helpful. And looking for that as a way to understand, okay, what things can be provided, you know, and having curiosity about it. Is this something that would work? Those are things that can help, you know, in terms of planning things and not overthinking. And then also
And
being
understanding
able to,
it's okay. That
right,
is
and
okay
understanding,
to have curiosity.
have curiosity because you want to know, and then also acknowledging a misstep. Say, okay, I'm sorry. We all make mistakes. Say, excuse me, I didn't mean to say that way. I call Rico. I don't know where that came from, but I said, right. I'm sorry. Excuse me. And it's okay to make mistakes, and understanding that there will be those. But when we're leading with the heart, leading with humility, cultural humility, questions, and trying to help, sympathy, and then empathy, trying to step into the shoes. Those are the keys to trying to find out, you know, what programming can work and how to help support others. You mentioned people with multiple, you know, biracial, other identities, considering that as well. Some people consider themselves that, and also consider themselves, like for someone who's Black and white, may consider themselves Black and also white, but not just one. So talking to them about, you know, how they would want to be treated and acknowledged. And so that's one of the keys, I believe.
Absolutely.
As we well, thank you guys. It's been a really fun and rich and challenging and emotional discussion all together in one. And so as we kind of wrap up here, I really appreciate everyone's time. And then, you know, that this effort that we're making here, showing our openness and just starting this conversation in our community, or restarting it, because there's been other efforts as well, you know, but just opening this space so that, you know, others can follow, and we can all work together and continue to build, you know, as a bleeding disorders community, and others can learn from it as well.
Absolutely.
Yeah.
Thank you.
Yeah. Well, thank you, Chelsee. Thank you, Brandon, and thank you, Rigo.
Thank
You're
you.
welcome.
Thank you all so very much. And thank you, everyone. And this, I feel, is just going to be the beginning, you know, of relaunching. And I think Mosey said it really well, relaunching, because this isn't the first time that we bring this to. But, you know, like everything, you know, let's get this back on the map, and let's make sure that we're, you know, we have a platform to start to move forward. So thank you on behalf of the Hemophilia Foundation of Southern California. We really thank you for your time, and, you know, this is just the beginning of future conversations.
Absolutely.
Thank you.
Thank you for reaching out, and thank you for just, you know, even thinking about this and coming up with this and asking Brandon and I to speak, because I mean, again, like you said, it's new, it's raising awareness, and it's just getting people to start thinking from a different perspective, and that's always great.
Right. And we also want to thank Ayanna Woods, you know, for helping with the vision. So thank you.
Yes, thank you so very much to Ayanna Woods. All right. Thank you, everyone.
All right.